Hello everyone, today's topic is angina pectoris. So, it's a symptom of ischemic heart disease. What happens in ischemic heart disease? There is a squeezing sensation or heavy pressure felt in the substernal region which can radiate to the left shoulder arm submandibular region. That is called and felt as angina. Okay. So when angina will disappear once the oxygen supply to heart muscle is increased or myocardial work requirements are lowered. Now, what are the signs and symptoms we see? When myocardium becomes ischemic, it produces heavy pressure or squeezing sensation in the substernal region, okay, that radiates to the left shoulder arm and submandibular region, which is often felt and called as angina. Now the dental aspects which we have to keep in mind while treating an angina patient. First, in pre-op, what we will have to do in pre-op before we start the procedure, what we will do is we have to administer glyceryl trinitrate to the patient, and sometimes oral sedation is also given if the patient is very anxious. So oral sedation we can give temazepam. Second is carry out dental care with minimal anxiety, oxygen saturation and BP and pulse monitoring. Effective local anesthesia is very essential, and the clinic should have ready access to medical help, oxygen and nitroglycerin. Now, the types of angina. What we will do in case of stable angina. Stable angina, we will have to reassure the patient, possibly sedate with oral diazepam and prophylactic administration of 0.3 to 0.6 mg glyceryl trinitrate if the patient has angina more than one time a week. Okay. Now, unstable angina. Unstable angina, all the elective dental care has to be delayed. Only opt for emergency dental care. First, pre-op 0.5 mg of glyceryl trinitrate sublingual or inhalation should be given. Then, along with that, relative analgesia monitored by pulse oximetry and local analgesia. And these patients are best cared for in a hospital as IV nitrates may be indicated in cases of unstable angina. Why we have to defer the elective dental care? Because there is a risk of infarction. Now for post-angioplasty cases, defer elective dental care by 6 months, only emergency dental care in a hospital setting. Bypass graft patients, they do not require antibiotic coverage against infective endocarditis. They should not receive epinephrine containing LA. Why? Because epinephrine precipitates dysrhythmia. Okay. Now patients with vascular stents that are successfully engrafted. So we have to give antibiotic coverage if emergency dental treatment is required during the first 6 weeks post-op. No elective dental treatment. Emergency dental treatment if required during the first 6 weeks post-operation, we have to give antibiotic coverage. Defer elective dental care. Patients are on a long-term anticoagulant. In these cases, vascular stent cases, patients are on a long-term anticoagulant. So deal with potential bleeding tendency by altering the drug intake. That's all for today. Thank you.